this is the pulse video, and at the end I'm also going to go over respirations. Remember that pulse and respirations are two different skills. So first I'm going to go ahead and do the pulse video so you know how to do that. So with pulse, the main thing to remember is that you're going to use your 2 to 3 fingers, find the pulse, your radial pulse on your thumb side, always the thumb side. Be careful about wrapping your hand around and pressing too tightly with your thumb because your thumb has a pulse. So if you're going to wrap around, you're getting nervous and you're clenching down a little bit, you're going to end up and pick up your pulse from your thumb a little bit, and you might get a little bit confused and lose it. You will have your examiner or your teacher counting alongside with you. They'll be on the other side on the other wrist taking the other radial pulse. You'll be using a clock, so you'll coordinate when you're going to start and end for your full minute. If for some reason in the middle of it you lose track, you get confused, something happens, just tell them I need to start over. That would happen with a patient too. Just keep on going, just restart counting. In the real world, you would go ahead and just recount if you kind of missed it. So with this one, don't be afraid. If you totally lose your count, tell them. It's better to restart and take an extra minute than it is to write down a wrong number and possibly fail your skill for it. All right, so I'm gonna go ahead and start, and I'll use over here from start to finish with our entry. All right, ready? Hi.
Hi.
Hi, Miss Brittany. My name is Jamie. I'm going to be your CNA today, and we're here to take your pulse. Is that okay?
Yes.
All right, great. I'm going to go ahead and close my curtain, invite my family out, wash my hands. I'm going to come back and check your ID and check the locks and grab my supplies, which are just my hands, and we're ready to go. Okay, so Miss Brittany, I'm just going to feel your wrist right here. I'm going to find the pulse first. My examiner instructor would be on the other side finding the pulse. They'll either be in a chair or they'll be in a bed for your state test. I'm not sure which, so we do practice in the chair. If you want to, if this is uncomfortable, Miss Brittany, I'm going to put your bed up, okay? I'm tall. It would be in your best interest to put the bed down. Just don't forget to put the bed down before you walk away. All right, so that's a little bit easier for me. All right, so I'm going to go ahead and look. We're going to pretend that somebody is here also taking pulse. We're going to say that we're going to count on the 12. Choose the 12, the 3, the 6, or the 9. It's going to make it easier and go. So now I'm counting the pulse. Every time I feel it beat against my finger, I'm counting in my head. If it gets difficult, close your eyes. It'll make it a lot easier. Because if you close your eyes, you'll be able to feel a little bit better. It'll reduce that external stimuli. As you notice, it will get uncomfortable. It is a long minute. You have to count for the full minute for your state test. It will be quiet. Don't talk like I'm talking. Just stay silent for the full minute. All right. All right, my minute's up. Okay, now get your number. Keep your number in your head. Lock it in tight. What you're going to want to do is you're going to want to run over and chart. Don't do it. Keep your number in your head. You have to chart with clean hands. All right, so Miss Brittany, is there anything else I can do for you? All right, great. Your bed, let me go ahead and put that in the lowest and low position. And we're going to make sure that you have your call light way over there. What's your strongest hand, Miss Brittany? Your left. All right, I'm not going to reach over you. I'm going to go ahead and walk around you. Okay, terrific. We're going to get that call light in that left hand. Okay, excellent. Come back around. And make sure that your bedside table. Would you like a drink? Your table is clean and dry and within reach. I'm going to fling my curtain back. I'm going to wash my hands. And then I'm going to invite my family back in, forgot that, and I'm going to jot down my charting. I'd come over and I would grab my form and I would jot down my reading, and then the form looks something like that, okay? This should be straight out the Prometric website, so that is our form. You would have already signed it to prove that you received it. You just put your number down. As far as I know, they do have two of the examiners take it with you. That way there's no discrepancies. That's why there's 2 spaces. So there's no telling what may happen for your state test, but if they tell you to do it twice, do it twice. Once I'm done jotting down my charting, what's the last thing that I do? Wash my hands. I'm gonna go ahead and wash my hands because I have to end my skill with clean hands, and that would be the end of your pulse skill. You would say, my skill is done, but you have to make sure you wash those hands. That's always the last thing you do before you look at your examiner and say, my skill is done. So that would be my pulse skill. So respirations. Respirations is almost nearly exactly like the pulse video, so we're just gonna kind of blend it in with this. The only thing different with respirations is you don't want to tell the patient that you're taking respirations, or else they're going to alter their breathing. So, already out of breath. So what you want to do is just tell them that you're taking their vital signs, and then you're just going to kind of hold their wrist as if you're taking their pulse. You don't have to feel it at all. All you're doing is just kind of faking them out so that they think that you're taking their pulse, but you're not, okay? So I'll just do the beginning of that, and then we'll kind of shorten it and move through. So this is going to be respirations. Knock, knock, knock. Hey, Miss Brittany, my name's Jamie. And we're going to be taking your vital signs today. Is that okay? Great. All right, I'm going to go ahead and fling your curtain, invite your family out, wash my hands, check your ID. I'm spacing. It's after lunch. I'm tired. Check your ID, and then I'm going to lock your bed and then go get my supplies. Did I forget something? I feel like I'm forgetting something. All right, Miss Brittany, we're going to go ahead and take your vital signs now. And then I would just kind of do the same thing. If I needed to raise the bed, I would. I would just loosely put my hand on her finger so that she feels like I'm taking her pulse, but I'm not. You don't instruct the patient to breathe. The other examiner is going to be right here, possibly right here. You're going to decide where to start counting. You count for a full minute. Remember with respirations, the inspiration and the expiration or inhalation and exhalation is one respiration. So in, out is one respiration. So you count each in, out. That's one. You count those for a full minute. When you're done, again, keep your number in your head, and then you go through your exit. So I'm done taking respirations. You go through exit A, B, C, D, E, F, G. You know, fling my curtain back, bedside table, call away, and then I would wash my hands, come over, get my form, which I've obviously made up a number, and that's what your form looks like for your respirations. Just about the same thing. All the forms are on your Prometric website for the state of Florida. And then the last thing I do is wash my hands again because I charted. And as long as I didn't forget anything, my skill is done. Is that it? All right, we're good.